Welcome to Business Authority Radio, bringing you insights from today's thought leaders, professionals, and influencers. With your hosts, Neil Howe and Craig Williams.
Hello and welcome to the show. This is your host, Neil Howe, and today my special guest is Melissa Windsor. She is the Outpatient Clinical Director at Valley Hope. She has been in the drug and alcohol workplace for 17 years. She is a licensed professional counselor and a licensed alcohol and drug counselor, and has a master's degree in counseling psychology from Northwestern Oklahoma State University. Welcome to the show, Melissa.
Thank you.
Well, let's get right into it. I want to talk about a major problem in our country, and there's definitely certain areas around our country that it's a bigger problem than others, but that is drug and alcohol addiction. Tell me a little bit about why drug and alcohol addiction is such a big problem, specifically in the Oklahoma City area.
We have some interesting statistics from the state of Oklahoma. We have some of the highest rates of mental illness and substance use disorders. According to the Oklahoma Department of Mental Health and Substance Abuse, our Oklahoma ranks third in the nation for mental illness and second for substance use disorders. Statewide, close to 1 million adults need addiction treatment services. So it's a very prevalent issue in Oklahoma, and we obviously need all the resources that we have available to help us with this problem.
Yeah, it definitely seems like a major issue that is all across the country. To hear those statistics about Oklahoma specifically is quite shocking. 1 million people needing help. That's a lot of people. That's a large percentage of the population. So tell me about the kinds of people that you help there in Oklahoma City. Where are the major problems?
We serve individuals who are 18 years of age or older, seeking treatment either at residential or outpatient for substance use disorders. And
I'm trying to get to the kind of person really that needs help. Who is it that you help? Is there a specific kind of person? You mentioned there's a lot of mentally ill people. Is that the core of the people that you see?
Well, our primary diagnoses that we treat are centered in the substance use area. That could be any addiction to any type of substance, from alcohol to opiates to methamphetamines. We can treat anything that they are struggling with in that arena. In relation to that, there are many of our patients that do have what we call co-occurring, which is mental illness along with the addiction, that we do have the ability to work with them and ensure that they have safe treatment for as well.
So that's definitely a major problem there, and having two together, the mental illness as well as an addiction, just obviously makes things worse. So,
absolutely.
What are the reasons that people are addicted to drugs in the Oklahoma City area?
There are, a number of reasons that an individual could begin using substances and then, develop an addiction. We believe in the American Medical Association's definition of a disease, of addiction being a disease. And, most times when people begin using a substance, they don't realize until it's way too late into their problem that they have addiction. And so I think that the majority of the time they develop an addiction unintentionally over just, casual use. And then it snowballs and becomes more problematic. But there are certainly, factors that weigh into a person's decision to use a substance. It could be economy. believe it or not, when people don't have the resources available to them, the idea of wanting to escape from that through substances becomes, a pretty significant issue. And so eventually they basically choose to use something unintentionally. Over time, it becomes a problem, and then they get into some major life circumstances where they're just not functioning well. And that's where we can step in and help.
So let's talk about the type of person that gets involved with an addiction. Just looking at some of the things that I find online, there's drug rehab for the homeless or for the low income, for couples, for mothers, for seniors, for the deaf, for the mentally ill. I mean, these are things that people are typing into Google and looking for answers. It seems like there's a massive spectrum of different kinds of people that need help.
Absolutely. We often say that this disease absolutely has no, what's the word I'm looking for? It doesn't specifically hit a certain type of population. It can affect any type of individual, regardless of how they were raised, what their social status is, or their income is. It just doesn't seem to matter. It just affects a wide variety of individuals, from very young to very old, and with all types of different lifestyles and socioeconomic status.
So there's still a stigma about drug and alcohol addiction that, there's a certain kind of person that looks like, but that's not nearly the case. But do you see common factors with people who come in for help?
There are some things that do present as being a little common, but it's never a rule of thumb over, the whole majority. A lot of times there is some type of family connection to substance use. Perhaps their parents or they have other relatives that are closely related that did suffer or struggle with some type of addiction. That is common. A lot of times we do see it generational.
And I know this can be a physical disease when you're actually on the drug and trying to get off it, but really it would boil down to the mental, would you say?
Are you talking about like withdrawal?
Not necessarily withdrawal. The reason that people get onto drugs and form an addictive habit in the first place.
There are physiological reactions that happen for individuals with like the disease of addiction. There are specific ways that a person's body would react if they are prone to having addiction that may or may not be similar to someone who would not. The level of craving that they have for the substance, the level of mental obsession is more prevalent in someone who would become addicted versus someone who would not.
So what does that look like? You said somebody who is prone to become addictive. What does that look like in comparison to somebody who is not prone, and how do you define that?
Oh, sure. Some of the ways to note whether or not you may or may not be having a problem is if you find yourself in a situation where you're using a substance, and when you walk away from using that substance, you feel as though that is the one thing that you definitely want to do again. That becomes something that you continually think about. It invades pretty much your daily living and your thinking. Those are things that don't necessarily present in someone who does not have an addiction. The physical craving itself is not always there in a person who is not addicted. So if there is a physical craving, like I really want to have that again, you want to watch out for that. That's a good red flag indicator there might be an issue developing.
I come from Scotland, where there's the whole culture is really revolved around drink. It's very much part of the social culture as you go out and you drink and you have fun with your friends and everything. Whereas in other countries, it's not necessarily the case. How do you know when you have a problem and whether it's just part of your social upbringing and the culture?
Oh, that's a great question. And the majority of the time, the patients that we see in treatment have some major life functioning issues. They are unable to hold a job. They have family members that are very upset, and they're not relating well to the family. There are issues in the marriage. Various family members are saying, "Hey, you've got a problem here. You need some help." There's usually some life functioning issues going on somewhere. We see it a lot with work. We also see a lot of legal issues. There, DUIs or other related legal charges. Those are basically what help become apparent to the individual that they have an issue.
So let's talk about some of those problems for a minute. Being addicted to drugs or alcohol, what kind of problems does that give to the person who's addictive as well as the people that affects?
What problems?
Yeah, like what problems does it create? One, for the person who is addictive, what do they go through on a daily basis? And well, let's just start with that one. The person who's actually addicted to the drugs, what kind of issues are they dealing with?
Okay. It becomes difficult for them to function on a normal, quote unquote, basis throughout their day. If they are in a cycle of having high cravings and high obsessions for using the substance, then it's going to be very difficult for them to do just the normal daily functions of life, getting up, getting dressed in the morning, getting ready for work, functioning throughout the day in their daily activities at work, like remaining focused on their work activities rather than thinking about when am I going to get to use or drink again. That becomes problematic. Their relationships with their coworkers and their family members, they begin to exhibit some frustration and anger, and that comes out towards the people around them. They might have supervisory issues at work, and at home have difficulty interacting normally with their family members. It becomes distant. They might eventually start choosing activities to pull them away from their family so that they don't have to be around those people that are trying to hold them accountable and love them. Yeah.
Well, there's definitely two sides to this. Obviously, there's the person that's physically affected and addicted, but then you also have the family and friends that are dealing with that person, as well as the employer and the economy. Talk about the other side for a minute. What goes through the minds of the family and friends and employers?
Yes, and we believe it to be a family disease, and we do want to provide treatment as well for family members, and we do have that available at both our residential and outpatient programs because the family members do suffer quite a lot right along with the addicted person. They are watching this person that they love and they care about very much basically become somebody that they're not, and they get distant, and the family member, their reaction is to try to move in closer and try to help and try to fix, and every effort and attempt that they make ends up not going the way that they hope. It ends up putting more distance, and then before long we see family members having the same issues as the addict or alcoholic. They start missing work because they're not able to even function or take care of themselves. Their thoughts and their life becomes consumed with, how do I get this person well? How do I fix them? and there's no way for them to effectively do that. So they oftentimes, develop their own symptoms of mental illness, depression, anxiety, and it becomes this, cycle, this really bad cycle between the alcoholic and the addict, which is why it's so important for the family members to get their help and their support that they need to get well.
So what can be done? What is drug rehab and how does it help?
So for at least what we offer at Valley Hope, we have residential and outpatient programs here in Oklahoma. In Cushing, Oklahoma, we have our residential program. It's a 30-day in-house program. The patient goes and stays, and they have family components of treatment where the family actually comes as much as they are able to, and around their schedule, be involved in treatment for themselves and their loved one as well. And we have outpatient where they can step down and have a long-term involvement in treatment. We have seen the reality that the longer a patient stays in treatment and their family members, the better the outcomes for their sobriety in the long run. So what we want to see is someone coming in, getting the help they need so that they can better function in their life and, correct these issues that started happening in the first place. If they can maintain abstinence from alcohol and drugs and do that in an effective way, and family members can find their way back to their own self-care, then their life functioning is going to get better over a long period of time, and that's what we want to see, and that's what residential and outpatient treatment offers.
So what does the program look like? How do you solve the problems? There's, the physical, the mental, the spiritual. What does the program look like when somebody checks in?
Okay, so we are able to meet the patient where they're at and specialize in compassionate care with proven 12-step milieu therapies that empower patients with the tools to live a healthy and productive, happy life in recovery. Through our program, Valley Hope's program, they develop self-respect, they find compassion and community, and they learn to forgive themselves and build necessary skills and tools required for a healthy life and long-term recovery.
So let's talk about the mental aspect of it. Obviously, the physical, it's a physical substance that they are addicted to, or a chemical substance. They have to be taken off of that. But really, the issues are probably more internal and mental. How do you help them with that mental solution so that they don't go back to what can be an easy fix?
Yes. A big part of what makes Valley Hope special is its founding principle based on loving the addict back to health. We call it the Valley Hope Way, but essentially it's love in action. It involves welcoming our patients and their families into our Valley Hope family with empathy and without judgment, just as they are. That relationship, that family bond is intended to last a lifetime. And because it is authentic, Valley Hope becomes the place our patients and their families trust. And our staff are the people they trust to help them get on the road to recovery.
So why do people have these problems in the first place? I'm trying to get a little bit deeper here, Melissa, into the mental thinking of somebody that gets addicted to substance abuse, and how do you address that problem?
Okay, well, and again, we use in our programming, we have a multidisciplinary team that works with each of our patients individually on their specific needs, what they present with, their problems as they come into treatment. We have assigned clinicians that do individual therapy, and they also do group therapy with their peers. It's a community-based treatment program. Many times they get strength and help from each other through our programming, which we think is vital for their long-term success and recovery. They also have chaplains that work with them on their spiritual aspects. We have medical oversight on the medical aspects of treatment. And mentally, what it really boils down to is having that direct support of therapists who, for most part, are living in recovery and connect with their patients and share experiences. That helps tremendously. But, a lot of that direct interaction with the other patient group members also helps them so much in the long term with the mental aspects.
So talk to me a little bit about the benefits of an outpatient versus an inpatient rehab.
Yes. The great benefit to residential programming would be that momentary disconnect from their daily stressors that are going on around them to help them really focus on what is causing them problems in their life without distraction. It's really nice to have them move away from everything else that's going on around them so they can focus in on what the problem is and how exactly to get them on the right road to recovery. And it works really well, getting them kind of away from other distractions and getting them really focused in on the problem. Also, in the community, when you're living with individuals who are struggling with the same thing that you are, it brings this sense of community and strength that's not there just out in the world on a daily basis. So you get that sense of camaraderie and connectiveness with the other individuals that are struggling with the same thing you are. There's so much shame attached to substance abuse based on like that stigma you talked about earlier in the interview. It just tends to do a lot and go a long way with the shame that's attached to having addiction when you're around people who are struggling with the same thing that you are. So that's very helpful to them in residential. For outpatient, there are some individuals who come into treatment needing help who are maybe what we consider to be higher functioning. They may not have had as many consequences to their use yet. Maybe they still have their job and they really want to hold on to that. They are able to arrest their use of the substance successfully by just having additional support while they're in their daily living circumstances. They can continue to work and do treatment and get help, while they're still functioning. And again, it just depends on each individual and where they're at in their substance use, how far it's gotten for them, and which one might fit better. And what we can do at Valley Hope when you give us a call is we will sit down with that person and talk with them about their circumstances and help them figure out which is the best place for them to start.
So that brings up another question about, some people being able to function and still keep a job. But, what happens when somebody goes away for 30 days and checks in? What happens to their financial aspect? And how do they look at that?
It's that's a really great question. And a lot of the reason why I think we see people not reach out for help is that fear of losing their job, the fear of a secret getting out and people knowing, we deal with that a lot. And many people don't reach out for help because of that stigma attached. And one thing that's important to note is that addiction is not a moral failing or a character flaw. It must be treated with the same skill and compassion that we approach heart disease, diabetes, or cancer. But like other chronic diseases, addiction often involves cycles of relapse and remission. But without treatment or engagement in a treatment program and recovery activities, addiction is progressive and it can result in disability or premature death. Removing that stigma and increasing awareness about addiction as a treatable chronic illness is essential to reducing the health epidemic. For folks that are coming into Valley Hope, there are important things to know. Today there are employee assistance programs in people's companies that they work for that can help them with, basically maneuver how to get into treatment and keep their job. There's FMLA. There are things that protect a person's job today when it relates to substance use treatment. And there's, of course, all kinds of protection of confidentiality with our HIPAA laws and things like that. So there's a lot of protection there for someone who is thinking about or wants to seek treatment. I would encourage them to do that. and use the resources available to them. Reach out to their HR department and find out what they have available that can help them.
That's good to know that, there are some things in place that are going to help them out. That's important information. And really, it is about education and getting these things out to people who are struggling. How do you reach these people that have issues with the right education?
Again, just educating on, working on that stigma that keeps many people from reaching out for help. We want to move beyond that and move beyond the fear of missing the 30 days of work or leaving home for a prolonged period of time. Just encouraging individuals to take that leap and reach out and ask for help when it's needed.
Yeah, it definitely takes, just one step to pick up the phone and call. Mm-hmm. But those are for people that realize that they have a problem, or maybe their family has intervened and are trying to get them help. What about the people that really are maybe forced into drug rehab, either by their family or maybe even a court order? What do you see? What are the results with those kinds of people?
It varies. We've seen a lot of individuals come to our programs that have what we call external motivation. That could be from the legal system. It can be from family members. And because of the milieu and the community type of treatment that we provide, we've been able to see those barriers come down as the patient is involved in treatment and interacting. Not every single person is quite ready at the moment that they walk in our doors, but we do everything we can to offer education and information about addiction to that individual so that they at least have the information and the knowledge when they are completely ready to go ahead and accept solutions to their problem. But there's a ton of information that they are given when they come to our programs on relapse prevention. We have psychoeducational lectures that we just offer them a ton of information so that they are adequately armed when they leave our programming to know what they need to know about addiction and know where they can come when help is needed. But we have seen so many come in with resistance like that, and because of the nature of our programming, that is able to kind of fall away over some time, and we've seen some real amazing breakthroughs.
So let's talk about Oklahoma City especially. What are some of the main problems that you see in Oklahoma City, and are there certain areas of the city that these problems are prevalent? For Oklahoma City specifically, I think, we see similar to the rest of the state, there are issues with addiction to, of course, alcohol, methamphetamines, prescription painkillers. Those are all very prevalent, even throughout our state, but Oklahoma City as well. And it says, one of the facts that I read recently, Oklahoma ranks second in the nation for substance use rates and leads the nation in abuse of prescription painkillers. So that to me is alarming. And then, of course, despite the fact that we have treatments that we know are effective, only 1 in 5 people who currently need treatment for substance use actually receive it. And I think that's another issue, is that we do have the need for substance abuse treatment in Oklahoma, but we don't always have the resources available to help. Why would you say Oklahoma City is the number 1 in the abuse of prescription drugs?
It's Oklahoma in general ranks second in the nation. It leads the nation in the abuse of prescription pills just because of the data that we've received for our area.
Is there, do you know, or is there a socioeconomic factor that is the result of that?
I think that we can certainly see some patterns and trends. Some is related to the economy, of course. When you see declines in economy, you see increase in substance use, and that's not unique to Oklahoma. That's pretty typical of any region or area. But certainly we've had some issues in that department lately, and that can increase the substance use rate in our area.
I know here in around Atlanta, there's in the inner city, there's some problems mainly with street drugs, but some of the major problems are in the wealthier northern suburbs of Atlanta. Do you see the same kind of thing happening in and around the city there?
I don't know that I can really comment specifically on that.
Mm-hmm. It seems to be there's a lot of problems in the affluent communities in and around the city where you wouldn't think there would be such problems. Do you see a lot of affluent people coming in?
We have a variety of individuals that come in. I couldn't say that we would have one specific kind of person coming in more than the other. We see a variety. We see young folks that are addicted to prescription pills, and we see older folks that are. It is not surprising to me to see any age, any socioeconomic status come into our programming.
So we talked a little bit about some of the misconceptions around drug addiction and alcohol addiction. What are some of those reasons that people don't reach out? You said 1 in 5 are only getting the treatment. What are the reasons that these other 4 out of 5 aren't reaching out, and what would you say to them?
It could be several reasons. One could be lack of knowledge of what's out there and what's available. The other issues are some that we have already kind of spoken about, which is the stigma that's attached to substance use and substance abuse issues. What would happen if I were to reach out and somebody finds out about my secret? What would happen to my job, my family? What if people know? What I would say is that you're not alone. There are individuals that are just like you that are in the same situation, and it's more than you think, and it's people that you would never think. It could be your minister at your church. It could be your boss at your job that has had issues, or knows someone else that has had issues with substance use disorder. So try the best you can to let go of that fear and reach out and take that leap of faith. And Valley Hope is available. We have a 1-800 number on our website, valleyhope.org. Reach out and connect with us and see if we can't help you get going on your journey to recovery.
Well, let's hear what that 1-800 number is for people that are listening to this that do know that they need some help and need to reach out to Valley Hope.
Okay. So Valley Hope's 1-800 number, my apologies, is 1-800-544-5101.
And do you have a number that's local for Oklahoma City or the Oklahoma area, or is it just that 1-800 number?
We do. Our Oklahoma City office, the number is 405-946-7337, and our Cushing number is 918-225-1736.
Well, that's excellent information, Melissa. I've been listening to Melissa Windsor. She is the Outpatient Clinical Director for Valley Hope in Oklahoma City. Thank you very much for spending the time with me, Melissa, and thanks for all the information that you've given.
You're most welcome. Thank you for having me.
And to our listeners, if you like what you hear, hit that like button and share, and we'll see you next time on the show.
You've been listening to Business Authority Radio with Neil Howe and Greg Williams. To learn more about the resources mentioned in today's show or to listen to past episodes, visit businessauthorityradio.com.